I would like to invite you to the St. Louis Racial Equity Summit. The title of this session is Breaking Barriers, Cultivating Equity in Alzheimer's Care, Research and Community Support for Black Americans. So these are my disclosures, and I'm happy to discuss them after the talk. These are my co-presenter Gabrielle Hannah's disclosures, as well as Elder Lowe's disclosures. If you have any questions about our disclosures, please see us after today's talk. So our learning objectives are the following. We'll discuss the impact of Alzheimer's disease on the Black community. We'll also review the importance of Black-led support options for care, for diagnosis, and even for supportive caregivers. We'll do a call to action to you in terms of helping us find ways to increase partnerships, as well as working with individuals and with faith and community leaders. This me still? It's still me? Okay. So this quote is by Dr. Kimberly Crenshaw, who coined the term intersectionality. And she states in her writing, the ways in which systems of inequality based on gender, race, ethnicity, sexual orientation, gender identity, disability, class, and other forms of discrimination intersects to create unique dynamics and effects. This is still true with many diseases that we look at that impact our greater community, especially diseases of the brain, especially dementia, and especially Alzheimer's disease. And if we look at our communities and we go back to 1619, where slavery first began, and the first slave ship arrived in the U.S. in Virginia in 1619. And with in 1700s, St. Louis, Missouri was founded, and Missouri was a slave state. In 1793, the first biracial woman bought land here in St. Louis. Did you all know that? Isn't that interesting? In 1854, the St. Louis Hospital was established. And then the Dred Scott case, which impacted the continuation of slavery, was tried here in St. Louis at downtown at the St. Louis Courthouse. The city hospital was open, and in 1865, Juneteenth marked the end of slavery. But we know from our history that there were many communities that were not made aware that slavery had ended for several years. When we look at the early 1900s, to the civil rights movement, we know that legal segregation of Black Americans and former slaves happened in 1913 in St. Louis, and Homer G. Phillips, which is in the Ville area, was established. And then the Hill-Burton Act, which prompted the creation of multiple hospitals around the United States, was done in the mid-1940s. The Civil Rights Act was then passed, and then the Fair Housing Act was passed. We also know in the 1970s, we marked closures of hospitals like Homer G. Phillips in 1979, where the hospital doors were locked. This impacted many communities, especially communities of color and the African American community, because now their safe haven for receiving health care was now closed. The physicians, the nurses, the techs were not informed that the hospital doors were closing. They showed up at work and it was locked. So imagine, you go to work, you think you're going to be providing health care to someone, and you can't even access the doors. In 1985, City Hospital was closed, and in that same year, a national report, the first report looking at health disparities in the United States, was written and published by Senator Heckler. In 1997, the St. Louis Regional Hospital closed. As we move forward, we know that the St. Louis Regional Commission was created in St. Louis. And in 2015, the Kelly Report, which was an update on the Heckler Report, was also written. So why are we here? We know in 2014, the year before Senator Kelly's report came out, Mike Brown died. We also know in 2020 that COVID-19 happened. And then in 2021, the Alzheimer's Association said, okay, we've had all of these things happen. We know certain communities are more impacted by Alzheimer's disease than others. We need to write a report about it. So they published their first report looking at race, ethnicity, and Alzheimer's disease in the United States in 2021. And then in 2025, we are here today to have this further conversation. So we have questions, and for those that are runners, we need your help. And if anybody puts anything in the chat, are you able to see that, our tech guru in the back? Nope. Okay. All right. So we have some questions, and there are, I think, sticky notes around the room where you could just holler out. I want to know, what are your health priorities? What's important to you? What do you prioritize for your health? We didn't tell you this session is interactive. You know, this is what happens when you have a college professor on a panel. So what are your health priorities? Physically active. Okay, go ahead and write it on a sticky note for me. What else? Diet. Okay, what else? Mental stability. What else? So physically active, diet, mental stability. What else? Sleep. Stress management. Sleep, stress management. What else? Cardiovascular health. What else? Mental health. What else? Relational health. Is that what you said? Relational? Okay. What else? What about our brain health? Neurological health? And if you think of others, please write them down on the sticky notes, and then one of our runners will come by and grab them. And hello to my classmate in the back of the room. All right, so we know that there are often systemic and systematic barriers that impact our health, but they also impact our willingness and ability to participate in biomedical research. So we know that there is mistrust in research related to historical abuses that are unethical. We know about Henrietta Lacks with the HeLa cells. We know about the untreated study of the Negro male looking at the disease progression of syphilis. We know about other things, but even in St. Louis, in our hometown, for those of us that are from here, the Cold War experiments happened, right? In communities of color and also communities that were poor and white. And that's when Roundup and other products were sprayed in those communities to kill vegetation. And the community members were not consented on whether or not they wanted those products sprayed. We also know that healthcare access and bias happen, especially for many communities of color, with African American communities, with Black patients being less likely to be diagnosed early with diseases like Alzheimer's disease and dementia, which often relate to our ability to have access to specialty care like neurological care. We know that there are some financial and logistical challenges as well, like cost, transportation, and the like. And we also know that culture sometimes will play a role in terms of people denying us the access that we need, or even the fear of burden that we have, that we assume that our family is going to have if we are diagnosed with certain health conditions and their lack of awareness. And so today, you are a part of that front line of helping us raise awareness about Alzheimer's disease and related dementia. So we know that what healthy aging looks like. It is more than just gray hair like I have or wrinkles. It is also aging. As we age, it increases our risk for diseases like dementia. But healthy aging is not dementia. Okay? So normal aging might have subtle changes that might happen in our thinking, how fast we might walk, and even our attention. But then if we have concerns with memory and thinking, the more severe those concerns are, we should be evaluated by our healthcare team, starting with our primary care physician and then asking for specialty care. So what is brain health? It relates directly to how well our brain functions in multiple areas. So I'm going to pass the microphone to Gabrielle, and then she will take it from here.
Thank you, Dr. Joy. So another interactive component, Dr. Joy discussed brain health, in which I'm surprised no one mentioned that during her last question. So now my next question is, what is one word that comes to mind when you hear dementia? Feel free to write it down or shout it out. There's no wrong answer. Okay, forgetfulness. Fear. Okay, yep. Family. Isolation. Memory loss, yep. These are some good ones. Caregiver, caregiving. Anything else come to mind? Okay. Well, again, my name's Gabrielle Hanna. I'm the Community Engagement Manager of DEI for the Alzheimer's Association Greater Missouri chapter. And so my component will go through a little bit of everything, right? But primarily the impact it has on our community and our surrounding communities. And then we'll go into how the DEI work falls into that. So first things first, when you hear dementia, you said all those wonderful things, but I want to make sure that we all are on the same level when it comes to the definition of dementia. So think of dementia as an umbrella term for loss of memory that interrupts your daily living. So similarly, there's cancer, this broad term. Cancer can mean a lot of things, right? Dementia has subtypes: Alzheimer's, vascular, Lewy body, frontal temporal, as you can see others. Cancer, similarly, brain cancer, lung cancer, prostate cancer. So the reason for people using the term dementia and Alzheimer's interchangeably is because Alzheimer's accounts for up to 80% of dementia cases, right? So curious, did you guys know the difference between dementia and Alzheimer's? No? Okay, see, now we level set. We're good now. So what exactly is Alzheimer's? It is a brain disease that will cause problems with your memory, thinking, and behavior. Symptoms eventually will grow severe enough to interfere with those daily tasks. And so keep in mind that Alzheimer's is a progressive disease, so it is fatal. There's not a cure currently for this disease, and therefore it will gradually worsen over time, where all other functions of the body do shut down. But in the early stages of this disease, memory loss is mild, so people are able to still function. You're still able to interact with people, but you might start picking up on a couple of things that might not be normal for that individual. And then eventually this individual will need that around-the-clock care. So that might be hospice or palliative care, because again, this disease is ultimately fatal. So when we look at the impact of Alzheimer's disease worldwide, here's some facts and figures. I'll let you guys take a minute to kind of look at that. But is there anything on here that's kind of surprising when you're looking through the facts? Yes. That is kind of a shock. Why do you think that is? I know I kind of put you on the spot. It's a really easy answer, I promise. We're just simply growing older. That's it. We're living longer. That's a great thing, right? But it's also a scary thing, right? Because that increases our risk of having Alzheimer's or another form of dementia. I think it's also shocking that 1 in 3 older adults dies with Alzheimer's or another dementia. There's 3 of us sitting on this panel right here. Just keep that in mind. I'm not wishing it on you. I'm just giving some perspective here. But just to put that in a full visual, right? That's pretty shocking. And another one is it kills more than breast cancer and prostate cancer combined. We hear cancer this, cancer that, and how so many people are impacted by that. I know a handful of people in my family who are affected by breast cancer. So I could only imagine having breast cancer and prostate cancer combined. That's more than less than more than people have with Alzheimer's. So let's get into the populations who are at a higher risk of acquiring this disease. So Black Americans are about twice as likely than their white counterparts to have Alzheimer's or another form of dementia. Hispanic Americans are 1.5 times as likely. And then we have at the bottom here, almost 2/3 of Americans living with Alzheimer's are women. And as you can see, I like to ask the audience questions. So why do you think these statistics are the way that they are? Any ideas? Our runners aren't going to help you because they know the answer. Okay, yep. It's a good one. Any other ideas? So historically, and Dr. Joy touched based on this, right, in her timeline, historically, Black Americans have been at a disadvantage when it comes to medical care and health care. There's those systemic barriers. So that trickles into this stat, right? Also, with that being said, there's a mistrust or distrust there in the healthcare and the medical care system. So we tend not to push for a diagnosis, right? Or an early one at that until it's kind of late at the later stages. Hispanic Americans are 1.5 times as likely. That could possibly be an immigration issue, right? Not wanting to go to the hospital or seek medical or health care for some reason their status is not where it needs to be, right? And having fear in that retrospect. And then almost 2/3 of Americans living with Alzheimer's are women. Interesting. Any ideas why we think that is? You said life expectancy? Ding, ding, ding. Yes, women just live longer. So that means we make smarter decisions, right? No, I'm just kidding. But yeah, so that's the thought process behind why these stats are the way that they are. So when we are discussing Alzheimer's, it's very important for someone to know what those warning signs of Alzheimer's are, to not only mix them or confuse them with something else, right, that could be treatable, but it's also important to note that someone who's experiencing memory loss can experience one of these, all of these, some of these. It really just depends on that individual and their lifestyle. So some of these things might not even apply to an individual. So I'll take a volunteer story that she told me, and she doesn't mind me sharing this. So she told me that her mother loved going to Michael's shop all the time, and that was her favorite store, and just buying all types of supplies for her craft. And she also said that her mom was pretty frugal. She was very strict with her money and her spending. Until one day she goes to Michael's and she just hands someone, another customer, $100 bill. And her daughter was like, "Mom, what are you doing? Like, this is not the cashier lady. This is just another customer in the aisle shopping. Why are you handing her $100 bill?" And she was like, "Because she needs it." Like, there was no reasoning behind why she gave her the $100. And so in her daughter's mind, she was like, okay, something's wrong. Like, you don't just give out money to give out money. It turns out she had Alzheimer's. So for someone like me who kind of just spends money and don't like, I am a great consumer. That wouldn't be a warning sign for me. But for this lady who's, very frugal and doesn't spend her money very carelessly, she's like, her daughter was like, no, something's wrong. So that prompted them to get a diagnosis or seek medical attention. So just keep that in mind when you read through these 10 warning signs, that not all of them will apply to that person. You have to see how they live their life and see what's so different and interrupting their life for it to be a raise of concern. Any questions here about the warning signs, by the way? Okay. So when we also think about our brain, we want to think of how to lower our risk of Alzheimer's and other forms of dementia. So the Alzheimer's Association public health team came up with 10 ways. Well, I shouldn't even say come up with, because these are pretty standard ways of lowering your risk for cardiovascular diseases. So why wouldn't it be the same for brain health? So essentially, you'll want to challenge your mind, meaning you'll want to be engaged in ongoing puzzles or picking up a new hobby to kind of help you get your brain juices going. Staying in school is a key component into lowering your risk as well. Eating right. So the best diet to follow is the Mediterranean diet, which is composed of leafy greens, legumes, berries, no red meat. And then you can also incorporate physical activity. So essentially, I'm not going to read all of these to you, but essentially what's good for your heart is good for your brain. So if your focus is on your heart health and your cardiovascular health, simultaneously you're doing a great benefit to your brain as well. So this is also just reiterating to take charge of your brain health. So moving on to the impact of Alzheimer's and caregiving. So someone over here, I think it was Michaela, who said caregivers and caregiving. When the question was brought up, what do you think about when it comes to dementia or Alzheimer's? And that's a key component, right? We oftentimes forget that the family and the community is also involved in the care of someone who has Alzheimer's or dementia. It's not solely on them, right, to make them feel comfortable. But we also want to keep in mind that the impact it has on caregiving is substantial. And I think Elder Lowe will share a little bit about that later on. But as you can see here, here's some statistics about the impact of caregiving. So primarily, adult children serve as the primary caregivers. And so with that, it's very difficult for the individual to cope with the new roles and responsibilities of doing that because they're so used to their parents taking care of them. And now those roles have been reversed. And so the demands of caregiving can limit a caregiver's ability to take care of themselves, right? So a couple of words you threw out was stress management, mental health. That all comes into the caregiving side of this disease, right? And so in addition to all of that, there's a financial strain. So if you don't face this in the early stages, one, you can fall into financial turmoil, but also we still want to make sure that we fulfill the wishes of the person with this disease who will eventually not have the autonomy to make those decisions when it comes to finances or how they want to live their life or who wants to be in charge of whatever, right? We need to make sure we get ahead of this so that part is also being fulfilled. So, as I mentioned, adult children usually are the ones who are the caregivers or the spouses, right, of the individual. But we often forget that there's grandkids and younger kids who are also part of that family. And we usually try to hide that from them, thinking like, oh, they're so young. We don't want granny or grandpa to, or have you see granny or grandpa like that, right? But I think we should take a different approach and really see that the youth has some value in learning about Alzheimer's and dementia. So we can educate the youth about Alzheimer's disease and foster that empathy and understanding. We can also encourage volunteerism and participation with the Alzheimer's Association and do certain activities, right? And then it will encourage that intergenerational bond. So at least within the Black community, there's a a lot of us live with our grandparents, right? The grandparents and the grandbabies are usually in the same household. So it's just going to be more beneficial for the youth to learn and kind of see and understand what's going on with their grandparents or their parents, right? If they have early onset. But also from that, they can contribute in a meaningful way with those daily tasks and providing emotional support to their parents or the additional caregivers, right? Because I know oftentimes that caregiver will need that space to take a breather, right? So maybe if you have a child who's 16 years old, why don't they just drive grandma to the hair salon and sit with her, right? Or if granny's unable to go to the hair salon, take the 16-year-old over to granny and just have her sit. But she now has that knowledge and understanding of what the disease is and how it affected granny. So now she can go about having a more meaningful interaction with her. So here's a couple of our resources that I just want to touch on real quick. So we have the 24/7 helpline, offered 365 days a year, weekends, holidays, and it's answered by professionals, not a robot. And so this is a great resource because you don't have to necessarily be someone who has dementia or be a caregiver. Maybe you just have a simple question about the disease, or maybe you want to volunteer. Whatever the question is, we will provide an answer, whether it's from us or we'll point you to the right direction. Free education and support is a huge one, right? We're out here trying to advocate and educate. So we do offer free education and support to caregivers. And then lastly, we have Trial Match, which is like a dating service for clinical trials and studies. And so essentially you just create a profile, fill out all of your information, and it'll pair you with a clinical trial or study that you're eligible for. So really cool tool. And I will note that with Trial Match, we want people who essentially don't have a connection to the disease, or I should say a family history, or necessarily experiencing memory loss. We need that control group, right, to compare and contrast why certain people are getting this disease versus people who aren't. And so with those resources I mentioned on the previous screen, these are just a couple of our community partners that I wanted to highlight, in which they're helping us bring out the word and bring out awareness. So specifically with the Divine Nine partnership, and I know we have a couple in this room, they are actively hosting awareness campaigns. They are doing this with a health equity focus, and then community engagement is a huge component of that. So with the awareness campaigns, essentially they're collaborating, the association and the Divine Nine, which are Black Greek letter organizations, to educate the Black community about Alzheimer's. That's one of the missions. Two is, in doing so, we're reducing barriers to care, increasing research participation, and promoting early detection within the Black communities. And then when it comes to community engagement, we partner with Divine Nine organizations and the Alzheimer's Association to drive the local and national Alzheimer's awareness. So doing community events, health fairs, coming in and speaking at their chapter meetings, just making sure that people have the basic understanding of what dementia versus Alzheimer's is. They have the 10 warning signs, and then they are able to embed those healthy habits into their daily lives or incorporate that into their loved ones that they're concerned about. And so if we look at this other side, with the DEI community organization partnerships, I want to highlight the AME Church because Elder Lowe is going to come up and speak about that partnership that we have with them. But essentially, we partnered with the AME Church because we understand that within the Black community, there's going to be that culturally aligned support with their help in doing so. And then we also know that the church, they're generally the trusted messengers of the community. When people are going through a treacherous time, usually they seek some type of spiritual or faith guidance. And so we understand that the church is generally that hub for that. So with the AME church or any churches or any faith organizations, we want to make sure we have that connection and that they are essentially we're collaborating and providing that education and support when their congregants come to them asking about the disease or what to do and where to go. And so on the local engagement and national recognition, we have the AME Church, the CME Church, Chi Eta Phi sorority, which is a nursing sorority, Urban League, which I know we're all familiar with. They are a huge partner with us. The Black Nurses Association, the Links 100 Black Men, National Council of Negro Women, Hispanic Chamber of Commerce, and we just recently got a local partnership with Telemundo St. Louis. And so I will pass it over to Elder Lowe, who will talk a little bit more about the AME partnership and how faith organizations can get involved.
Thank you, Gabrielle.
Got it.
And Dr. Joy, thank you so much for your presentation. I think this leads us to what I hope to accomplish this afternoon is, first off, let's determine what is a community. Then we'll talk about what are the characteristics of an effective community. And then we'll talk about what is a community partnership. And then what makes a community partnership successful. So first I want to do is let's just define what a community is. Just throw some out at me. What is a community? Okay? And what I'd like for us to really make sure we really understand is that while we don't look at it like that, we have, I'll say the average person has about 10 communities in which they're part of. For example, your family live in your home, that's a community. The church you go to is a community. For example, we find ourselves today in the academic community. Then you have community of race, ethnicity, or even just interest in general. So the clinical way in which we define communities, a community is a group of people who share something in common, thus community, whether it is geographical location, interest, values, or goals. It's kind of a social unit. Members, they interact together. They feel a sense of belonging. And communities are based not just on physical proximity, but also in thought. This morning I was talking to a young lady about she is caring for her mother. And so she's in the caregiver community. So as you think about your sphere of influence, you will find yourself having to determine what communities you're in. And the one thing that all communities have in common is what? People. There's people on the other side of every single thing we do. And if we try to deal with trying to determine what are our shared values, our shared goals, our shared ethos, who we really are deep down inside, it all is bounded by that sense of community. We have them in common. And luckily, the mere fact that we are human beings, we live in that community in and of itself. So what I hope that we can also figure out is how do we interact within our communities? For example, Dr. King gave us this wonderful term called beloved community. And the beloved community was bounded on what? Shared humanity. Everybody wants good schools. Everybody wants to be able to go to the store without fear of not being able to afford what you see in the store. We also want to make sure that in this beloved community, everybody is valued. Everybody is seen. Everybody is heard. And everybody is respected. Boy, oh boy, the beloved community movement really finds its place even now. Everybody being valued. Everybody being cared for. So we have to redefine what our view of community really is. And we have those things in common. Now, let's talk about 5 really quick characteristics of a community. First off, shared identity. You will not be a part of something if you don't share the identity. What's that saying about politics? You don't have any really view. You have shared views, and you also have things that you call, those are things that we have in common that's important to us. Then there's a shared purpose. No one will spend their time being a part of anything if you don't share the purpose. Then you have the objective. Now, sometimes you have to get in groups and you meet because you thought you had a shared view or shared interest. But very rarely do we spend time doing what? Finding out what the goals of that organization is, or the goal of that relationship. Too often, you get those things mixed up. And believe it or not, all of us can say what you thought 5 years ago, you may not think today. So sometimes, things that we call our group or our community becomes anachronistic. It's no longer useful. And therein lies the other challenge that we have, is that we get into things and we're no longer useful. So we forget those things to be important. Then there's a shared interest and passion. Passion. Just think of how often we get in community and we're not committed to it, to be passionate about it. And yes, you can be a part of something and be passionate about it, and it's not the right thing. You can be passionate about race, but you want to include other people's race. You can be passionate about gender. I'm a passionate person, so don't let my voice scare you. But we have to understand the importance of passion. Now, as we talk about, for example, for the AME partner, African Methodist Episcopal Church Partnership, about 8 years ago, we formed within the Alzheimer's Association, my wife, myself, and several other people were part of this, is we took a look at all the data that they gave. They said the African Americans are twice as likely to deal with this disease. And the Hispanic community is one and a half times as likely to do it. So we said to ourselves, that these communities are negatively impacted by it. So what can we do to stave the movement towards these people? We had to get the commonality of all races together to say we want the human race to be better suited to be a part of this. So we talk about how our communities can band together and figure out how can we do what is necessary, what is fitting, and what is proper. Just think of the community you're part of. Do you still have the passion? Do you still have the interest? Can you say that you're all marching in the same direction? Community. Now, when you form these community, when you understand what your community is, then you understand what's around you. There's a premise that we do in churches in particular. We do what is called asset mapping. That's exactly what it is. What are the assets? What are the skills? What are the gifts? What are the interests within those community in which you share with? And then, so-and-so's a good baker. Well, that's the person when you do a fundraiser for example, a bake sale. Someone's a good carpenter. You determine what skills, what gifts, and interests find themselves within the sphere of influence. Asset means exactly that. What things do we bring to the table? Therein lies the importance of making sure that when you bring people together, what they bring to the table is respected. Someone that's really good with spreadsheets, that's the person you want to do the project management document, right? They're good with spreadsheets. Someone's a great graphic artist. That's the person you want to do your bulletins. Someone is really connected with young people. That's the person you want to be able to go and get the young people interested in what you do. So as communities come together, as groups come together, you need to certainly determine where their strengths lie. In the partnership that we've had so far with the AME Church, African Methodist Episcopal Church, we have found out within our congregations, the average congregation has about a 10% effect rate with Alzheimer's. Now, what tends to happen is you don't help them if you don't tell them they're being helped. I know that sounds like a kind of oxymoronic statement, but sometimes people need to know that they need help. Because a lot of people believe, especially in these partnerships that we found out, is they have said that that's a part of normal aging. Absolutely not. My grandmother was 87 years old when she left here, and she was as smart then as I remember many, many years ago. Just because you age don't mean you have to be affected by this disease. Now, let's talk about partnerships. Again, I want to go back and I want to pull what I've said before and kind of tie it into a nice little ball here. We talked about shared interests. Give me some more. Shared interest. What else? Shared values. What else? Shared identity. Yes, yes, yes. Skills, gifts. Then, when you partner what you have with what other people have, that's when the success happens. Now, when we're shying away from this premise of diversity, equity, and inclusion, well, let's think about the greatest diversity is what? The greatest diversity is what? The diversity of thought. What you think, what you think, what you think, what you think, what you think. The greatest diversity we have is the diversity of thought. That means we get in this setting and we share what's on our minds. We share what our lived experience has been. And therein lies the strength of the partnership. Everybody brings to the table the best of who they are. That's the only way the community can be as strong as it needs to be, as viable as it should be. When we go into the future, everybody brings their best to the table. Now, you see this hand? I mean, see the graphic there? What do you see in this graphic, for example? Connection. Absolutely. Each of them are bringing who they are to the table. That's what partnership means. That's what community means. What else do you see? What else do you see out there? Come here, please. Care. I care for you. I see you. What else? There's one more thing I want to make sure we don't leave before I sat down. What else do you see there? I see mutual respect. That's one of the most important things that we need to hold on to, or one of, when we talk about community, we talk about partnership, when we can join those two words together, community partnerships. There must be a spirit of mutuality. Now, E for DEI is what? Equity. That means that everybody gets a chance to sit at the table. Now, I don't want this to turn into a DEI discussion, but you need to understand the importance of those three letters. Now, I know some people think that it's taken away from someone. That's not what it means. We have equitable opportunity to give our best, to be our best, and to do our best. And then finally, inclusion. Communities do far better when everybody gets a chance to bring their best to the table. Now, I'm not talking about trying to get numbers. That's not what I'm talking about. I've lived long enough to be in that era too, where numbers were not fair. That's just the way it is. And to get a certain number of a certain people, you probably didn't get the best always. But the community partnerships must happen. Now, what has been, to me, the greatest asset, if you will, of the community partnerships with the Alzheimer's Association? First off, we've allowed people to not be so concerned about what they can't do, but what they can do with help. That's important. Because you don't have to be able to boil this ocean by yourself. I'm going to tell a quick personal story, and then I'm going to sit down. When I first heard of my mother back in 1993, my mother was diagnosed with Alzheimer's. And at the time, I was a corporate trainer for Southwestern Bell. I had been in Houston all week before I was in Arkansas, and I knew my mother was dealing with something before I left. So my sister called me that Wednesday night, and she said, "You have a meeting tomorrow. You home? She come home tomorrow?" I said, "Yeah. I'll be home about 5:30 on Thursday afternoon." Well, the doctor said he'd meet us at 6. That's okay with you? I said, "Fine. I'll do the best I can to be there on time." My 3 brothers and my sister, we met in the room, our community of family. And the doctor came in, looked at us. He said, "Your mother has what is known as dementia." Now, I'm on full disclosure. None of us had heard of dementia before. Just didn't know it. And he said, "Any questions?" And we didn't know what question to ask. My sister said, "Well, what is dementia?" He said, she'll have memory problems. That's what he said to us. And he turned around and walked out of the room. And what I've said to myself is, if I have anything to do with it, nor the family, nor the community will ever have to deal with what we dealt with. So you don't suffer in silence as part of the community. You don't suffer in the silence as part of a partnership, because we're in this thing together. Now, it is my hope that we understand the concept of what community means, understand the concept of what it means for us all to be inclusive, and also bring to the table diverse thought. That's my spiel. I know I'm boring, so what I'm trying to do is to get you to think outside of yourself just for a moment. and determine what your communities are that you belong to. And what partnerships can you form in terms of working with people to make the world a better place? A unified community is a better place. A well-crafted partnership is a better place. And more importantly, you need to figure out where you fit along the continuum of being a part of a shared view. Thank you for your time.
Thank you, Gabby and Elder Lowe. We appreciate that. And so just moving on for a few more things while we have you as a very attentive and loving audience. So going back to what Elder Lowe was mentioning, there's a quote from Desmond Tutu that says, "My humanity is bound to yours," where we can only be human together. So if we think about the assets that we have in our community, if we think about the needs of caregivers, if we think about the needs of those that live with us that have cognitive changes, we collectively create a more humane society for us to be able to receive the care that we might need or that our loved ones might need. So we need to think about this in terms of how we can really be actively engaged. From our individual stance, we know what our cognitive health looks like. We know when we have changes. We also know when things are changing around us that might cause us more stress. For women of a certain age, and I don't lie about my age, I just turned 51, I'm perimenopausal. And I noticed that because of menopause and being perimenopausal, there have been some changes in my memory and thinking. And I do Alzheimer's disease research. So, I was like, oh, Lord, what's going on for real? So, and then there's a little fan with the hot flashes and stuff like that, which means I really didn't forget my thought when a hot flash happens. But now those are normal changes that are happening to my body as a result of me becoming older, not necessarily linked to Alzheimer's disease and dementia, right? But we also know that our individual changes are also in how we might feel about ourselves. We might look at our sisters or our brothers or our spouse who are at that interpersonal level and say, hey, have you noticed anything different? Have you experienced certain things? Have these things occurred to you? And we say, oh, girl, don't even be thinking about that. You fine. But we also know that symptoms of Alzheimer's disease and related dementia start 20 years prior to diagnosis. Did you know that? 20 years before. So we know as a collective, as a community, it is important for us to be deeply engaged so that we can raise that awareness. And it is important for us to fight towards policy change where everyone has the opportunity to receive the care that they need in terms of diagnosis, treatment, and opportunities to engage in research, as well as opportunities to share their stories. So Elder Lowe spoke about faith and our belief systems and the systems of those around us. He spoke about spirituality. We know not everyone is a Christian. We know not everyone is a Muslim. We know not everyone practices a real religious foundation, but some people may have a spiritual walk, or they may just have a walk where they are collectively a community where they like to talk and engage. We talk about our purposes and what drives us in order to have wellness and health. We know that our community is how we fellowship together and how we meet at different crossroads in order to make sure that our values are seen. We also know that it is important for us to really think about cognitive health and brain health and ways to improve it in a way that we can talk about dementia as not a no word, where we can talk about Alzheimer's disease, where it is beyond just grandma being senile, but where it is some opportunity for her to have some new care. Because this is a good time in Alzheimer's disease research where we now have new therapies that are coming out, which hadn't happened in over 20 years. So when we think about equity, this quote is from Dr. John Morris. Dr. Morris is just stepped down from seeing patients, about a month ago? Is that right? So about a month ago. And John is my mentor. And he said to me, he was like, I need to bring you back to St. Louis. And I was like, why? I was at Mayo Clinic. I was not planning on moving back home. He's like, I think you can do some good things here. You should come home. So he said in a paper, we can't say we understand Alzheimer's disease until we understand it in all people. So he's a neurologist. He created the clinical diagnostic rating scale, which is the clinical scale that is one of the front lines for diagnosing patients with dementia and Alzheimer's disease, right here in St. Louis at WashU. He also said, and we won't understand it in all people until we start doing a better job of studying it in all people. We have a duty to provide the best possible care to all of our patients. And I agree with him. Because if we are not providing opportunities for everyone to have the best health care, then how can we increase overall wellness? Right? And if we don't provide access to specialty care like neurological care or provide those frontline providers, we're talking nurse practitioners, physician assistants, primary care doctors, family medicine, internal medicine physicians, the opportunity, and even other specialty areas like OB-GYNs and cardiologists, the opportunity to learn about diseases of the brain, especially cognitive impairment and dementia and Alzheimer's disease, and there's other types of dementias, then we're not doing the justice of making sure people can actually attain overall wellness. All right, so thinking about where we are in a society, I have a question or two. Does the current social unrest impact Alzheimer's disease diagnosis and treatment? Does it? Where we are right now, does it impact it? I am asking y'all. And then, I'm a college professor, so I'll start pointing at folks, which etiquette wise is not appropriate. Yes, ma'am.
I'm aware of the fact that I think there's been studies that have connected it to depression. And so I feel like we as Black people have a lot of trauma. And so I don't know if this is specific for Black people with this question or racism. So I think that we're more susceptible, our brains, to deteriorating because of the stress and oppression we've incurred overseas.
Do you know what that's called? It's weathering. So the more that we experience stress, trauma, adverse childhood events, racism, sexism, all of the isms, hidden curriculum of not knowing how to engage, or the etiquette of the communities in which we are now a part of, all of those things can impact our cognitive health and our cognitive reserve and cause weathering, which can increase our risk for certain diseases of the brain, and certain diseases of the heart, and certain diseases of the endocrine system, and certain diseases. All of these things are interconnected. So what about research participation? Do you want to participate in research if you think that you're not going to be seen or heard or have a voice or know that what's being studied is not going to further marginalize your community? So my job as a Black woman scientist is to make sure that don't happen. And I know that's bad English, but I have to make sure that don't happen. And I'm going to say that again. I have to make sure that don't happen. So my job, I have a greater responsibility. I was a caregiver for my mother who had mild cognitive impairment, and her cognitive health was usually off a little bit if she hadn't eaten, if she hadn't slept, if her blood pressure medicine wasn't taken, if her dialysis didn't work, and all of those things. And she's no longer with us, so it's my story to tell, and with her permission, even though she has transitioned. And so I think about all of those things. And if I want to stay healthy, I have to be reminded that when I was caregiving, I had more symptoms of weathering than I do now. You know why? Because my first priority was taking care of my mom, which meant that I missed doctor's appointments, which meant that I didn't take care of certain things in my marriage, which meant that I didn't do some of the things that I needed to do in order to make sure that I had wellness. And my husband saying, okay, you need to go get a pedicure. You need to go do something for you. So those are the things that also impact our health. And that also impacts whether or not we want to engage in other areas. So there are other things that also impact our ability to engage. And we know that we think about our built environments and the neighborhoods that we live in, and even risk factors for Alzheimer's disease and related dementia. We also know that certain neighborhoods have more disadvantages than others, and that those neighborhoods had a greater population of people living in those communities with more cognitive decline, meaning that there was more deprivation and that there was greater risk for developing other diseases of dementia like Alzheimer's disease and related dementia. We also know that neighborhood resources is associated with lower rates of cognitive decline. So neighborhoods that had resources like transportation, walkability, community centers, and even open spaces like parks and things like that, there was less cognitive decline. Even environments that had better air quality, guess what? Less cognitive decline. Residential segregation, which happened in the early 20th centuries in cities like this one, St. Louis community, which has a history of discriminatory zoning and restrictive covenants that often lead to disparities which are linked to Alzheimer's disease and related dementia. We know that there are areas where segregation is often linked to race. Segregation is always linked to race, and that residential segregation has decreased in some communities, but not all communities. And we can look at the impact of segregation on where hospitals have closed here in St. Louis, which means that those communities also have less transportation. There's no Metrolink in deep South City or deep North City. There's no buses stop running at a certain time of day. Am I lying? And there's no hospitals. And then we have clinics that are starting to pop up, but those clinics have limits because they don't have the staffing for specialty care like neurological care, or the resources to provide the referral to specialty care. So we know that people that often self-identify as African American are disproportionately affected by Alzheimer's disease. So for me, as a scientist, when I moved back home and I got this new faculty position and moved into a nice, shiny new office, I told John, or Dr. Morris, I said, I think I want to write a grant. And he was like, I think you kind of have to do that in order to keep your job. So I did that, and we got $3.4 million in funding from the National Institutes on Aging to create what we call a research registry. And the registry is looking at diversifying Alzheimer's disease research within the Alzheimer's Disease Research Center called the Knight ADRC at Washington University School of Medicine. A large proportion, Dottie, do you remember how many of our participants in the ADRC are Black? Is it like 20%? Okay. 20% of our current participants from 1979 to date, which is when the ADRC started, self-identify as being African American or Black. But we know that African Americans are what? Twice as likely to be diagnosed. We also know that we have, I can't remember the statistic for Hispanic, but it's not that high either. And so one of the things that John and I did, that Dr. Morris and I did, was we decided to create this research registry called co-equal. And co-equal is a word. It is not hyphenated. It is one word. You can look it up in the dictionary. And the reason we chose co-equal, because it was not just about equality or equity, it's about both. So we wanted to provide opportunities to increase health equity and equality for persons at risk for Alzheimer's disease and related dementia in the St. Louis area, which means we wanted to create a registry. This registry really focuses on looking at communities that are often voiceless. But before we did the actual creation of the registries, we wanted to hear from our community. So we had a series of listening sessions that we call Brain Aging Cafes. And we conducted those cafes with 306 people. Actually, one of my board members is in the room. He helped me with that. Thank you so much, sir. You know who you are in the back of the room. Hello. He helped us design this process. And we spoke to 306 people. We did in 14 sessions. 90% of our participants were self-identified as being Black, with about 5% being self-identified as being white. 8% of our participants in these listening sessions classified themselves as being Hispanic or Latin. And the average age was 68 years, and most of our participants were women. So we learned a couple of things. We learned that cultural needs regarding health and wellness and research were very important, that the impacts of Alzheimer's disease and related dementia expanded each of the communities that we talked to. Barriers to and facilitators or opportunities for change related to access to care services being provided in the community and other resources, and that the availability and accessibility of educational resources was also hindered the opportunity for proper access to care, and that barriers and facilitators to research participation related to building sustainable partnerships, not just coming into the community, dropping off a couple of flyers or talking to folks and leaving, but actually building sustainable relationships where research could also happen that was of interest to the community. And we wanted to make sure that we were effectively recruiting and retaining research participants to the registry. So we did ask questions related to that. And these are two of the selected quotes. I'm always drawn to participate in some ways because Black people don't participate. And another participant said, due to past experiments that took advantage of Black people, people are weary of participating in research. So we wanted to acknowledge both of these things because both can be true. Both can be true that people are afraid to participate in research. Another thing that can be true, if they do participate, they're afraid they'll be diagnosed. Right? So my job is to what? Saying, let's talk about it. Let's figure out where we can come to common ground so that we can provide an opportunity for you to engage in research in a way that feels helpful to you. So the co-equal registry is related to increasing enrollment in NIGHT-ADRC studies as well as affiliated studies. And so we've developed a process to refer and test the feasibility of co-equal to serve as a point of entry for several studies at the NIGHT-ADRC. And many of those efforts are led by Dottie McDowell, who's sitting in the audience. She created a process where we can actually streamline how we capture enrollment into other studies, and it's really amazing work. So I want to thank Dottie for leading that effort. My research lab, which is the Ballsbury Lab, is now in the process of recruiting participants from our registry into another study on exercise, where Michaela Coleman-Vizard is sitting right here as well, and she's one of the leads of that project, and we're working with other study teams as well. To date, we have 1,015 people in the registry. About 76% or 78% of the participants self-identify as being African American or Black. A majority also are women. And then our mean or median age is about 68 years. And I'm looking at Dottie because Dottie runs my numbers for me. Just to make sure that I'm not misspeaking. And unlike the ADRC traditional cohorts, which had people that were college graduates and beyond, most of our participants have a little bit of college, about 13 years of education. So we need to really think about justice. And what does justice mean to the voiceless? It means that we have the opportunity to fully engage in efforts that we want to engage in. It means that we are not being left out of the space. It means that if we are given a seat at the table, that our chair is not lower than the other seats. It means that we have the opportunity to really be heard, not gaslit, not told that our opinion does not matter, to be listened to. It means in terms of healthcare that we have the opportunity to receive quality healthcare in a timely manner so that we can have the life and the wellness that we want. It means when it comes time to participate in research that we are truly asked if we want to participate and that we understand what that participation means and looks like for us. What are the time commitments? How much do I have to give? And who are you going to share this information with? It means that if we come to a place where we need caregiving, that our caregivers are also taken care of. It means that we push back on policymakers when they don't remember these things. So the time is now. We must acknowledge that disparities exist. We must not fear discussing historical underpinnings of science that marginalize communities of color, especially Black communities. We must consider new ways of engagement and partnership, be it faith-based communities, with our spiritual groups, with our groups that work with communities of color, be it service providers, be it researchers at WashU, at UMSL, or other academic medical centers or academic institutions here, be it working with community organizations like the Urban League or the D9, and big shout out to my sorority, Alpha Kappa Alpha Sorority Incorporated. And it means we also must determine ways our programs can increase health equity.
All right. Thank you. So that concludes our session. And I just want to leave you guys with a couple of things to think about throughout the day. One, what communities are you a part of? Elder Lowe really described that very eloquently. And then two, research, right? Dr. Joy did a very good job of why it's necessary to participate in research. So I encourage you guys to look into that. And maybe it's not Alzheimer's related, but maybe there's another health issue that you're curious about and see if you're able to participate in that. And three, what could you do to help raise awareness when it comes to Alzheimer's and dementia? So if you remember that one slide, over 7 million people are impacted by this disease. So I'm sure that someone in this room, and actually I'll ask the question, who in this room knows someone who has Alzheimer's or dementia? See? And that's almost everybody in this room. And it's a small group. So imagine if we got everybody at this summit and we asked that question, how many people do you think would raise their hand? So it could be something very small by sharing the helpline number. It could be something small by providing a warning sign or just looking out for those warning signs. It could be something small that you do on your own by reducing your own risk and engaging in healthy habits. So that's what I want to leave you guys to think about. And then also our information if you have any questions. All right. Awesome. I think that's it. 3:15 on the dot.
Thank you.
Thank you, everyone.